Hi, my name is Dr. Alyssa Cohen with Pelvic Floor for Moms. I'm going to be talking about painful intercourse today. There's lots of different reasons and conditions that can contribute to painful intercourse, but we're going to be talking more about like pregnancy, postpartum, specific reasons why you might be experiencing painful intercourse and then what to do about it. So I have my little post-it note here. Most of the reason why you would be getting painful intercourse postpartum is either tension in pelvic floor muscles or scar tissue. There's 3 layers of pelvic floor muscles, so we can definitely get tension in these more external, smaller muscles. That's going to cause more of like the painful penetration, which often manifests as more of like a sharp, stabbing, burny sort of sensation. You can also then, or often also have pain in these deeper layers of muscles. That's going to be more of like a deep ache with deeper penetration. Sometimes feels like you can't get deep enough, or like you hit like a hard end feel, that kind of thing. That's going to be more of that tension in these deeper pelvic floor muscles. I think it's hard to understand why we would have tension in pelvic floor muscles postpartum. Most of us think that it's like those muscles just get really stretched out and relaxed and more we have to strengthen postpartum. But those muscles are stretched really quickly during delivery. Sometimes we get some tearing. There is trauma to those tissues, and so when muscles or body parts are traumatized and injured, our body wants to tighten to protect that area. So that's where we can get tension in those muscles. And then scar tissue. So obviously with perineal tearing, we can develop scar tissue after that. Even if you had no tears, you imagine like that vaginal opening has to go from really small to really big. So you would imagine that there's probably going to be at least some bit of micro tearing in those muscles as baby comes out. So that's where we can develop those painful intercourse situations postpartum. To address the muscle tension issue, when people come to pelvic floor physical therapy, what we're doing in clinic is we're doing manual release of those pelvic floor muscles. So we're using one finger vaginally to basically trigger point release. So we find a tight spot in those muscles and hold until that muscle tension releases. And then we're also teaching you how to do that at home. So I have a video on YouTube also of how to do internal pelvic floor release yourself at home using either a finger, you can use a thumb, you can also use wands at home, so that is certainly something that you can start working on at home. I wouldn't do, and therefore at home you're not going to do internal release until at least 6 weeks postpartum, when ideally things are healed up a little bit better, or at least you've seen your OB or midwife, your provider, and they say, yep, everything looks good, you can start to, work and mobilize those tissues. The other thing that we can do to create mobility is stretching and foam rolling kind of things. So I have a stretching playlist on YouTube too, so you can go check out the stretches. Deep squat stretch, child's pose, those sorts of things are going to get that pelvic floor in a lengthened position. And then we use diaphragmatic breathing. Again, videos on YouTube. We can use diaphragmatic breathing to breathe into those pelvic floor muscles to create length and relax those muscles. We can also use mobility tools. So by that I'm talking about like foam rolling, lacrosse ball, things like that. Any of these muscles, if we are getting blood flow to any of these muscles around and connected to the pelvis, we will be getting blood flow kind of indirectly to those pelvic floor muscles. We want blood flow to muscles to help heal the tissue, but also blood flow helps create relaxation, warmth, and length in those tissues. So rolling through the backside of the pelvis, piriformis, glute med, things like that. Adductors, which are going to be those inner thigh muscles here that attach up into the pubic bone and that sort of thing. Foam rolling there can be really good. Again, stretching there. So get your foam roller out, do some of those mobility tools, especially if you haven't been assessed, you don't know what's happening in your pelvic floor, you feel uncomfortable with treating that yourself, you can very easily do external work that is going to benefit you long term. In terms of scar tissue, most of the time, I'll put this back on the pelvis. Most of the time, that tear is going to be from vaginal opening back towards anal opening. They grade it from a 1 to a 4. 4 means all the way back to the anal opening, tearing through the anal sphincter. One is just kind of through the skin right at the vaginal opening kind of thing. So this is most of the time where we're gonna get that scar tissue. Now granted, tearing can happen anywhere. Tearing can happen like on the labia, tearing can happen up towards like clitoris and urethra. Usually your provider will tell you where your tears were so that you know like, oh, I should work in that area on scar tissue, or go with pain as your guide, right? Of like, oh, when I have sex, I feel it more on my vulva or more towards the front. That's probably where it would be worthwhile to work scar tissue. But there's no wrong way to work scar tissue. We're just trying to get those layers of tissue to like slide and glide across each other better. So with perineal tearing, the ways we can do that is even just like 2 fingers on the perineum, just like gentle massage that way. Usually that tear extends slightly into the vaginal opening. So if you just go 1 knuckle deep into that vaginal opening and just kind of massage back and forth there at like 6 o'clock, if we imagine the opening as a clock, you can just gently massage there. We never want it to be painful. If you already are experiencing pain with sex, you'll probably notice some discomfort when you do any of these mobilization things. So we want to make sure that we keep pain level at a 3 out of 10 or less. So when you're doing that scar tissue release, 3 out of 10 or less. So you can do it that way. Also with these perineal tears, you can use a thumb and a forefinger. So if this is my perineum, for example, and then this is like the vaginal opening, I would put my thumb on the perineum, fingertip in vaginal opening, or vice versa, whichever makes sense. But then you're gonna kind of pinch your fingers together to kind of approximate those fingertips and roll that scar tissue between your fingers, trying to break it up that way. So you can kind of do a pinch maneuver. Same thing, like if you were tore through your labia, you can do that too. Find that area where it's tender, a little sharp feeling, and then just get that tissue between your fingers and rolled around a little bit. So that's how we can work on scar tissue and tears. The last thing to think about with painful intercourse, well, not the last thing, one of the things is lubrication can matter a lot. So when you are postpartum, hormone levels are fluctuating significantly. Estrogen levels are likely going to be low, especially if you're breastfeeding. Estrogen levels will stay low through the course of breastfeeding. Estrogen helps our vaginal tissue stay pink and plump and moisturized and things like that. And so when estrogen is low, we can be a little bit more red, a little bit more irritated in those vaginal tissues. And so using a good lube that is pH balanced and good for your body. Some of the brands like KY and things like that aren't going to be as good. Brands like Good Clean Love, Uberlube are ones that I like to use. Uberlube is really nice for scar tissue because it's silicone based, and so it makes it really slippery, which can be great. So using a good lube, and then you can also get a prescription for a topical estrogen cream from your provider. If they, go see your provider, make sure they think that is useful and necessary, but applying estrogen topically there can help with how the tissue feels. The other thing too is there are vaginal moisturizers that you can just buy over the counter on Amazon. The one from Good Clean Love has hyaluronic acid in it. That hyaluronic acid helps bring in moisture and kind of keep it there effectively. And sometimes it can be as effective as the topical estrogen cream. So some of those over-the-counter options are good too. So using something topically can help. And then if you've had pain with sex, especially for a prolonged period of time, every time you go to have sex again, you start to anticipate that this is going to be painful. Your body starts to guard, and it can be a perpetuating issue, even in absence of tissue dysfunction. So getting back to penetrative intercourse postpartum when you've had a course of pain might be a slow process, and so you need to be able to communicate with your partner of like what is feeling good, what is not feeling good. You might need to work on some like non-penetrative things first. So working with your partner to be intimate but not penetrate can help you work up to penetrative sex again. Also doing some stuff to calm your nervous system beforehand. So doing some of those stretches on that stretching playlist, doing some deep breathing, some diaphragmatic breathing, and preparing your body that way can be a nice way to slowly work up to normal penetrative sex that you're used to having. So there is hope. We can help. It doesn't have to be as scary as you think it is. Hopefully that's helpful.